Have you wondered how well Canada is doing in taming COVID compared to other countries? What countries are the real success stories and why? In what ways has Canada failed? I asked pandemic historian and City Councillor Jamie McEvoy about these questions. To start, I asked how some countries have managed to keep their COVID numbers low.
There's a few different ways they did it. One of the surprises is that it was predicted when COVID reached Africa that it would be an absolute disaster. And Africa, there's a couple of exceptions like South Africa and Tanzania, but Africa has not done that badly as expected with COVID. And part of the reason is because several African countries had to deal with Ebola and had already implemented the public health measures, even the refrigerators for vaccine. And so they were prepared. They were prepared based on fairly recent experience, and they kept those public health abilities in place and that public health infrastructure in place. They didn't shut it down afterwards. So you have a place like Liberia. Liberia has had a low rate of death. It's about 1 death per 55,000 people. Almost right away, they introduced screening at airports, they introduced contact tracing, and they introduced quarantine. Liberia was doing contact tracing before the WHO or anybody else was recommending it. It was just that the government decided right away they were going to develop a plan and implement the plan. And so that's what they did. It was fast action combined with public health that people have trust in. So countries that really introduced regulation quickly fared well. And, I'll say that in the United States and Canada, I think there was a certain amount of, this started in January. We're going to kind of have some very minor restrictions and we're going to watch and see what happens. And then we get to March and everybody knows it hasn't been officially declared a pandemic, but it's about to be because it's begun to meet the criteria of being out of control in several countries on different continents. And a lot of the Western countries still weren't taking very many measures or doing things like blocking travel from China, one country, when this had become an international thing. So I'll take the example of Taiwan, right? Taiwan in January, they shut down international travel. They shut down flights. They shut down any cruise ships. They did that within the first month. And they didn't wait till March. They did it within the first month of the first report coming out of Wuhan. The other thing that Taiwan did that's interesting is when people were quarantined at home or even asked to stay at home, they provided people with a stipend. So you didn't have a situation where people might have the sniffles or a cough, but they still went to work because they needed the money. Because what they did in Taiwan was they just covered that difference for people so people could stay at home. And in the United States and in Canada, some of the worst outbreaks in food plants, for example, were because people actually had symptoms and they went to work. And the theory is that people are more inclined to have to go to work when they don't have any kind of protection or even sick leave. We don't have national sick leave in Canada, right? So you don't have any legal right to stay at home and get paid as your way of trying to be a responsible citizen. In Taiwan, they did that right off the bat.
I wonder why it is that they were so clued into what they should do.
Some of it is preparation, but I don't know if there's a consistent factor in why some governments reacted quickly or not. I mean, I've read a lot of history about pandemics. There's a great book called The Plague by Albert Camus. It's a novel, and it's a good representation of how people see it coming but are slow to act. And they're slow to act because they don't want to shut down travel. They don't want to close the city gates. They don't want to shut down the economy. But also people are just slow to come to grips with reality. But another country I could look at is Vietnam. Vietnam has had 35 deaths the entire time, 35 deaths. And what happened in Vietnam was that They suspended entry of all foreigners in March. No one can go into the country except for very, very limited specific circumstances. But they began to take measures when the first case was announced. When there was a case announced of coronavirus in Wuhan, it only took one case before Vietnam realized, well, this could be another SARS, this could be another H1N1 type flu, but we're going to prepare for it right now. And so in January, Vietnam had put together their national committee, they had put together their national strategy, and they were already implementing it before the end of January.
What kind of government do they have? Do they have a democracy?
They do not have a democracy.
That probably makes it easier.
Yeah, I can give a democratic example, but one thing I'll say that was different from Taiwan as compared to China is that, Vietnam, is that Vietnam allowed transparency right from the start, right? So whereas right now the World Health Organization is, saying they're being denied some access and investigating the origins in China and Vietnam with the same type of government, the Vietnamese government decided that, this is healthcare. They're going to report the numbers honestly. They're going to share them with the World Health Organization. And they did kind of what British Columbia did. They put the scientists in charge instead of government officials. But Taiwan is a democracy. New Zealand is a democracy. American Samoa, for that matter, which has had no deaths, is a democracy. And what they have in common is that they took early action, and they took the level of action that would be needed to actually stop it. So some people say, well, New Zealand is an island, right? Well, Vietnam isn't an island, and Vietnam has a border with the place where it broke out. But New Zealand did have a pandemic plan. And so when a pandemic was declared, the New Zealand simply put into place the plan that they already had to deal with this kind of situation. And when some aspects of that plan didn't work, for example, New Zealand had a plan for testing and contact tracing, but they weren't able to do it at the level they needed to. They weren't able to get it together. So then they introduced lockdown. So one of the things New Zealand really did right is not only act early, but also recognize when the system isn't working and take further measures, and don't hesitate to do that. New Zealand introduced a quarantine on travelers arriving in the country. Canada is just getting that organized now.
There was a requirement that people quarantined all the way along, but there was no real enforcement of that.
I remember there was a point at which Canadian government told the provinces that international flights would only be able to arrive at the international airports. And then the province of British Columbia discovered that included Kamloops, because Kamloops has flights from the United States. So it isn't an international airport, but was still having travelers in. And it was the government of British Columbia that was putting people into airports because the federal government wasn't putting people into airports. So there were people arriving in the country who didn't even know they were supposed to honor some kind of quarantine, right? Mm-hmm. But I think one of the things that historians will find bizarre about this is the things where we just relied on people being honest and having goodwill. Because in a pandemic, a pandemic by definition spreads easily. It doesn't take very many people. In fact, we know it's spreading in BC sometimes, even when people think they've taken all the precautions and they think they've been consistent on that. So I think that will be one of the mysteries for the future, is why some countries kind of relied on voluntary goodwill to deal with the problem. But when you look at countries that initially did that, like Australia and Britain, it didn't work until they took legal measures.
To me, it would just make sense for the country to just close down for 6 weeks. Everybody gets paid some money to stay home for 6 weeks.
They've tried the short-term lockdowns in Europe. They do bring down the numbers, but it's really important what happens after that, because if people just say, okay, we've hit the switch and now we're lifting the restrictions again. COVID gone away in very many places. And it's one of the most opportunistic infectious diseases that there are. That's why it's so dangerous. It spreads easily. And in fact, it is mutating to spread more easily. That's what the variants are about, that we're worried about. There are actually hundreds of variants, but a lot of those variants just go away because they're not as effective as the current disease. So the 3 or 4 variants we have now that are more infectious, that's going to continue to be a thing.
Interesting. So one of the things that kind of has disconnect for me is Quebec and Ontario, for example, they're they're opening up a little bit, but they're opening up just as these new variants, which are much more contagious, are coming on stream. So I don't understand that logic at all. Do you understand it?
I do understand the logic. The logic is they're looking at the actual numbers. The numbers are going down, and they want to allow for some more activity in society. But I think the mistake that they make is there's a real lack of clarity there. So I'll take the example of Britain, right? Britain decided to come up with a slogan. The epidemic was pretty bad in Britain. The slogan was, "Stay home, protect the National Health Service, save lives." That was the message the government adopted for the public. They had their daily press conferences, but they used that slogan, "Stay home, protect the National Health Service, save lives." And they advertised it widely. They pushed it on social media and in advertising. And they increased their rate of compliance. I think it was from 77% to 92%. It's a simple message. People got it. They understood it, right? And people understood stay home also meant take the other measures. So in Ontario and Quebec, you have a system where it's regionalized. So a person in Toronto might not be under the same rules as a person in Kitchener.
Right.
Then they have this tier system. And I don't think people really understand very well what the color-coded tier means. And there's 5 color codes, right? We have this in British Columbia too, but the government hasn't been using that as its central messaging, right? The government hasn't been trying to get people to understand what 5 different levels of pandemic mean and how all the measures are different, right? The government in BC have really just focused on what's the current situation, here's what you should be doing. Right. But in Ontario and Quebec, between the sort of the regionalization of the measures and the different tiers and fairly regular change, I think that it's leaving a fair bit of confusion, and it's creating something that, really people who are rigorous and taking the pandemic seriously, they understand they're just going to stay at home and wear a mask where they go. But other people are not getting a clear message of what the situation is and what they should be doing.
To me, one of the kind of the worst areas of messaging, and maybe it's not so much message, well, it's messaging, but it's messaging to institutions, and this is, retirement homes, don't let anybody in. So what we have is all these people dying from neglect, never mind COVID. They're not getting fed, they're not getting the water, the hydration they need. I mean, that is terrible. And now I guess they're sort of beginning to realize that, gee, maybe we should let some of the families in to help out.
Canada, to be honest, Canada doesn't have much to be proud of here, right? We don't have vaccine manufacturing capacity because we used to have it and it was privatized in the 80s. Our military, and I've read the reports on Quebec and Ontario. I encourage anyone to read them, but make sure you have a seat first because they're not nice. Talking about how elder care has worked in Canada. At one time, Canada had a 7% mortality rate. It was actually one of the highest in the world. And at a time when the world was having about a 2.5% mortality rate.
Are you talking about in general?
The reason for that was because of the conditions on our old age homes, which are very crowded, very slow to respond. They had the economic situation for the workers is terrible. So you had people trying to work 2 jobs, sometimes more than 2 jobs, working in different facilities because a lot of people were restricted to part-time work. So we just didn't have good conditions. And if nothing changes out of that, I think that would be very sad. I know that Premier Horgan has said there will be $1.8 billion spent in BC so every senior can at least have their own room. But, you know, imagine this situation. You have a virus ripping through, you know, an old age home or a care home, and you have, in some of those homes, you have 4 people to a room. How are you going to contain that?
Mm-hmm. Yeah, so it seems to be a major failure in how being regulated or governed.
It's been worse in private care homes than in public care homes.
Do you think we're going to have a bad 3rd wave?
I think we have a good shot of avoiding a 3rd wave. I think the world is going to have a 3rd wave. I think some countries are effectively in their 3rd wave now. It is a real race, you know, to get this vaccine to people before more people get sick, right?
Right. Well, all I can say is I hope somehow we don't get overwhelmed with these more contagious streams that are coming out of South Africa, Britain. I'm not sure where.
That's a pretty serious issue in those parts of the world that are going to be vaccinating more slow, right? That are not that are not able to, you know, beat the rich countries in terms of buying vaccine or distributing vaccine to people. And so, you know, countries that are currently out of control, like South Africa, like Tanzania probably is. Tanzania insists that COVID is over. The president of Tanzania tells people to gather in churches and pray it away, and they've stopped reporting their cases. So it's probably out of control in Tanzania.
Right.
It's on the rise in Britain again. In fact, the new variant is the most common variant now in Britain. So the country I really worry about is the United States, to be honest.
Yeah. Mm-hmm.
And the reason I worry about the United States the most is because that's a country where only 2/3 of the people say they're willing to get vaccinated. And that's not enough. So I'm hoping that, you know, Americans will drift into a willingness to get vaccinated. I actually think that's possible.
Okay. Well, thank you so much.
Okay.
Yeah, great.
Thank you.
Have a good evening.
Have a good dinner.
Will do.